Hey, Jules the Doula here, welcoming you to the Virtual Mama Connection. Listen in with me every week as we bring you birth stories and experiences straight from our parents' hearts, always providing you a lifeline of education and communication, keeping you ahead of the game with the best care providers and educators. And just a little reminder out there, anything you hear on our podcast is not to be used as medical advice. Please visit our disclaimer on thevirtualmamaconnection.com. So glad you're here because the last time you were coming on, during that whole COVID pandemic, and you were my first care provider that jumped on because you wanted to really help all the moms that were feeling stressed and alone. And remember those days?
It's true. Everybody was really, really upset. Everybody was really worried. And I'm glad I could help out. I was glad I could,
Yeah.
give some good feedback, some good information from at least the information that we had. I mean, there's still a lot of information that's going to need to come out. I mean, we're still learning so much about that, the virus, what it does, how it affects pregnancies, how it affects moms, how it affects, people who have long COVID and things like that. So
Yeah.
there's still a lot of information, and the information changes every day. So, if now you're still worried about it, I say just talk to your provider about it.
Right. Well,
Yeah.
it was nice to have you on every week. I remember you chiming in and the midwives would come in as well. And it was, I know you helped a lot of people. So it's good to have you, Dr. Christine Press Jones, with us today. And you're the owner and founder of Center for True Harmony and Wellness. And that was started, what, like 18 years ago?
Like 18 years ago in Mesa.
Gee,
And we've been in the same place, and we're hoping to get, now that we go to both Banner Desert Medical Center and Banner Ocotillo Medical Center, we're hoping this next year we'll be able to open a second location that's closer to Banner Ocotillo Medical Center.
that's a great hospital. I love
Yeah,
that.
it is. It's so community feeling, everybody is supportive of each other and friendly to each other, and we have there's big birthing rooms and
And the time.
tubs and showers and balls, and everybody's using spinning babies and hypnobirthing, and it has a lot of pluses, so
It does. And it's so comfortable. And I think it's great for the significant others too, because it's a bigger room that it's more comfortable for them.
yeah, it really does kind of let you, be a family in there.
Yeah. Yeah.
Yeah.
Well, so when you go into your center, and I've been in there a lot, it's such a warm environment. You don't feel like you're going into like the clinical doctor's office. It feels warm and homey. You've really created a beautiful like atmosphere and environment in there. Was that always your vision? What was your vision? Because
It
you've really
was.
grown. Yeah.
It really was. So when we first opened, my first thing was there's going to be no white walls. There's no white walls. Everything has to be painted, and it has to be welcoming. It has to be furniture that's kind of comfortable. There has to be a welcoming, not only for the mom, but for the whole family. Now, COVID kind of messed with that, where we only wanted the patient
Right.
to be there. We didn't want even the dads to be there for a little while. But now that things are changing again, it's nice. It's opening up a bit more. I'm starting to see the babies. I'm starting to see some
Nice.
of the um other siblings that maybe I, got to deliver before, and now they're older or sassier or whatever.
That's
It's just it's fun to be a part of somebody's family, like, and I hope that they always kind of remember who I am. Every time I see somebody who maybe saw somebody else, I'm like, oh, who delivered? And they're like, I don't even remember. I'm always like, oh, I want to be, and I want my center to be like Yeah, that's where we had you. That's where we
Right.
became a family or expanded our family. Or, maybe you need something else. I mean, we're not just OB, we do gynecology too,
Yeah.
So, there's massage, acupuncture. Dr. Groby is a naturopathic physician. So that's where the wellness part comes in there, because we know that if you have a healthy mom, you have a healthy family. So that was our goal when we opened the office.
A lot of my mommy clients also love that they get, if you have lab work, you just get it done there.
Oh yeah,
Same
so
with
we did
ultrasound.
expand over the last years to have ultrasound, and it's a
Yeah.
3D, 4D ultrasound. And then we created space, and now we have the volume to support Sonora Quest, lab person in there. Now she's there Monday through Thursday, but most of my MAs can draw labs anyway. So if you had to come in on a Friday or Saturday and get your labs drawn, you could get them done.
Right. Yeah. It's just such a warm atmosphere. You don't really feel like you feel like you're going to a wellness center more than the doctor's office, I feel like.
Well, I'm glad that was the point.
Yeah. And, we've been in deliveries together, you and I will
We
say
have.
you bring an energy into the room that's a blessing. It's this big, bright light of positivity and like, okay, let's have a baby, and the moms need that at that point.
Of
And it lightens it
course.
up. It makes them feel better. You can just feel them go, oh, she's here.
Right. Right. And, birth is really a natural process. We're afraid of it, where we make it sometimes, so we're afraid of it, where
Right.
we,
We put things in our head.
when we put things in our head, we think too much about it. And I've had 3 boys, my own, and one of the biggest things that I remember having to do when I had my first son was I had to almost disconnect from my body in order to let it do what it needed to do. So I felt like I was sitting on my shoulder,
Observing.
observing what was going on, and telling myself, you can do this. You've got this. Just let it happen. And that helped me, like, for that release, to allow that
Sure.
baby to come.
Mm-hmm.
So that's the part but you have to train for that. We don't really do that anymore. We want to control everything. We
Right.
want to, like, you get up at this time, work out at this time, take the dog out at this time, and everything, the school, everything is like, blah, 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 blah. And we don't rest in the afternoon like they do in some other countries. We go to Starbucks and get a coffee so that we can, like, push through. And we're kind of always stressed out. And the problem with that is, then you're supposed to just relax and let everything happen. How does that happen?
Right.
How do you do that? That's, so then you have to almost train for it. You have to do things like
Hypnobirthing.
hypnobirthing or hypnotherapy, like maybe even before you are going to have a baby, you think about doing some hypnotherapy.
Definitely.
Or meditation, relaxation, yoga, like things that are going to help you to allow for the natural rhythm of your body to just happen.
Mm-hmm. Being in tune, going within. Right.
Yeah.
Yeah. And I do feel like women, because of like the lifestyle you're describing, I do feel like women do need to train for it because they're not used to rolling that way every day. Their schedule's like bam, 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 bam.
Our society doesn't even allow for it.
Yeah.
Doesn't even allow for it.
Yeah. I think it's wonderful. You guys really support that and the hypnobirthing and
lots of like tools, lots of tools and
especially
recommendations.
And if they want an unmedicated birth, they can't just go in willy nilly.
Not usually. I've only seen one patient who
Just
she's
rolled
like,
in.
I'm just going to do it. And she did it. And I was really proud of her.
Yeah.
But, most of the time I'm making all these other recommendations and things like that. So
Did
to
you all,
allow for it.
yeah. Did you
Mhm.
always have the vision for the midwives? You always knew you wanted to bring midwives
So,
in? How'd that come
no,
about?
because originally in Arizona, midwifery was like home birth midwives.
Right.
And you can't really bring home birth midwives into the hospital. But as time went on, more and more certified nurse midwives were being trained. They were out there, they were being sought out. And I felt like I practiced very much like a midwife. I would be like, did you get the patient in that other position? Well, no, because nope, no excuses. Turn her over, get her in that position, give her an hour. Next thing you know, she's complete and +2 and ready to have a baby, right?
Right.
So, or let's just give her a little more time. Or, I feel like somebody else would have been one of my OB-GYN peers, the doctors, might be a little bit like, well, they're not meeting these criteria, so it's time to go to a section or something like that.
Right.
I feel like I practice and my office with some of like our recommendations from a naturopath, things like herbs and teas and tinctures, and we
Oh,
we were more uh like midwifery friendly. So once it really started to take off in Arizona, um I hired my first midwife, and now there's like five of them.
yeah. You do a good job in who you bring in too. They're like
Good. I'm glad
walking
you
little
like them. Yeah.
angels. I
Yeah.
do. I love them. They're very sweet and they're excellent. They're so good and they're so
Sometimes they like know the most recent recommendation on something before I even heard about it. And I'm like, and they're like, we should do it like this. I'm like, okay, like, so, and they're always getting more training, learning things about spinning babies,
yeah.
helping the baby get in the right position, learning things about postpartum depression and things like that. So they really love their patients too, our patients, and we try to be very collaborative with everybody.
Yeah, I'd say that's the response I get back from all my clients that see you guys. They love all of you, you know.
Good.
So, yeah, it's been a great journey being able to work with you guys and uh
Yeah, it's been wonderful to work with you too. I
oh,
love hypnobirthing.
thank
Love it.
you. Thank you. So, with the midwives, would you think you'll bring more in? Are you guys pretty set with where you're at?
Right now, we are pretty set. If anything, we're going to bring in another physician because it's
Okay.
probably time for that. So I'm hoping over the next year, 6 months to a year, we can do that. Like with another office, we'll have enough
Sure.
room. Yeah.
That's
Yeah.
good.
Yeah.
Exciting new things on the horizon. Well, look
I
where you
know.
started and it was great then. And then look how it's just grown and you've developed such a beautiful center. You should be very proud of yourself.
I am. I am. Thank you. I am.
That's a wonderful thing you've done. What about, okay, so here we're talking about how you're very kind of like holistic, alternative minded, where you're open to the unmedicated process and helping moms, your patient in that delivery process and the whole bit. What about the moms that hit that 35 years old, their AMA, and they have oh, we might have to have an induction conversation, and they all get really upset. And it's not just your office, every office at 35, right? Their AMA, they're going to have that
Right.
conversation. So this might be a good time. And you're probably the perfect person to talk about it because you're so open to, we want to let you do what your body does on its own and the whole bit. But sometimes there are valid concerns, right? That we need to take into consideration.
Yeah. So, seems like every week sometimes there's a new recommendation, but over time, even just the population of women who are having babies has become a little bit later in life because, you want to finish school, you want to um, get your career established. I mean, I'm no different. I mean, I had my first child at 34 and my second at 36 and my third at 39. So for 2 out of 3, I was considered advanced maternal age, or which is terrible. Elderly is
Yeah.
like the ICD 9 or 10 code or whatever. Is ridiculous, but
I must be in the geriatric unit.
I guess so. So anyway, um it what it really means to us is that, you know, first pregnancy, older pregnancy, we just have to watch you super careful. So you're watching your baby's growth, we're watching the fluid level around the baby, we're watching things that may give us an indication that it's time to have a baby a little bit sooner. Okay. Sometimes your blood pressure goes up.
Sure.
Some women get the gestational diabetes, and all of this is just a little more common in the advanced maternal age patient. Also, even like early on genetic problems like Down syndrome or trisomy 13 or trisomy 18. But all is not lost. That's why you have us, right?
Right.
That's what we do. We're watching you more carefully. So the recommendation is to deliver you at 39 weeks or so, 39 to 40 weeks, because we don't want to have it where your placenta is just not doing what it needs to do. So we just notice that as time goes on, you're at a higher risk of stillbirth, slightly higher risk in somebody who's advanced maternal age. So our recommendation is to deliver a little earlier. Some people don't want to deliver a little bit earlier. Maybe they do want to go out to 40 weeks, then we can do biweekly testing. But we don't really want you to just keep going like till 42 weeks, because we know that by that time, a lot of times that placenta just doesn't have it in it to even get you through all that labor. So you're just at a high risk for a C-section. And, we're talking about natural birth, natural labor, natural whatever. So like you said, a lot of times it's small things that we have to do to encourage your body to go into labor.
Right. Going slow.
Going slow, taking our time, letting your body take its time, but encouraging it not to let your pregnancy continue for like 3 more weeks or something like that.
That makes sense. And ultimately, I think women all need to keep in their head too. We're trying for a vaginal birth, right? At
We're
that
trying
point,
for a vaginal birth, but also we're trying to have a healthy mom and a healthy baby. The other goal that's important, which doesn't always happen, but is also not the end of the world, is that sometimes, babies end up staying in the nursery and the NICU a little bit longer than mom. Mom gets to go home. But in the end, what's our ultimate goal is to send home a healthy mom and a healthy baby, in the right time, so that, they can start their bonding as a family, together.
100%. So then when that process sometimes needs to take place sooner and we go into an induction, I think there's so many moms out there who maybe they're hearing this and they're just now pregnant and they've heard horror stories about being induced. It's really not like that anymore, right? I mean, like I don't experience that when patients have to go in and get an induction. It seems like, all right, your cervix is here. This is probably the wisest choice for us to start. And it seems like everyone just, you care providers make smart, educated decisions along the way of what's best for mom, especially if she's wanting an unmedicated birth, that there's plenty of things to start and do a gradual it seems like a gradual induction almost.
Well, I think that's the smartest way to do it, is to, we're just kind of encouraging your body to do in a shorter period of time what it's naturally going to do usually,
On
right?
its own, right.
So, if somebody has very high blood pressure and they have to have a baby like at 37 weeks, well, that's a lot earlier than 39 or 40 weeks. So we have to just encourage your body to do in maybe 48, 72 hours what it would do in 2-3 weeks. That's really what the goal of an induction is to
Mhm.
just encourage your body to get where it needs to go. So where do the horror stories come? Well, I mean, I don't know. I think from a patient's perspective, sometimes you think, well, I'm going to go in, I'm going to have a baby, in 2 days or in 24 hours or something like that. But that's not even that's not even natural. You know what I mean? Like a natural labor is probably going to take 24 hours,
Right.
from beginning of labor, prodromal labor, active labor, push the baby out. Um, occasionally you have somebody who like their water breaks and they deliver in 3 hours, and that's like bully for you. Never
Yeah.
happened to me, but
Me either. Yeah.
I always had to fight for them, but
It's fun to see for the moms when that happens, but it's rare.
yeah, but it's rare, but it's not the usual.
No.
The usual is your body slowly ramps up and, takes you forward, and then you have a baby, and then you have to recover too, that's another thing.
Right. It's good that you guys talk to them about postpartum and things like that too at your
Yeah.
office, because
Yeah.
I feel like we need more awareness in our whole culture here in the States, because, other countries put more of a preference, or a preface, I should say, on, taking care of their moms after delivery and giving them more time. And,
Right. Like
so,
a year off. I think France
geez.
gives everybody a year off, and they have like a helper, mother's helper, and I mean, it's not what we do here, and we really should. A lot of times I see moms struggling because they just need some extra help, some extra sleep, but also they need to be able to say to themselves, to us, to anybody, hey, I just can't do it like this. This is not this is not working. This is not
Right.
working.
Or
It's not
something
working.
doesn't feel right.
Right.
Right. Yeah. And there's nothing wrong with it. They just need to
Oh,
get it out.
yeah,
Yeah. Yeah. Then there's things that we can do to help them.
absolutely.
Yeah.
Tons of resources,
Mhm.
tons.
Yeah. So, what would you say if a mom's listening to this and she's all excited because she's surfing the podcast and the whole bit, and she's thinking of getting pregnant? So, she's not pregnant yet. What do you think a woman should really consider before, like, while she's trying to find her care provider, or like questions she should ask when she first meets and goes into an office? What do you think are some really key things that women should, so that they know, oh, I'm at the right place, right?
So, um,
Besides, do you take my insurance?
right. Besides, do you take my insurance? I don't know. I think everybody's going to have a certain set of questions that's important for them.
Yeah.
But I think what they need to think about is what do I want from this experience? Now, you don't always get what you want. I'll be honest with you. There are times when people prepare
Yeah.
for whatever, and everything.
Goes out the door.
Yeah, everything. Like just open the window and throw the baby out with the bathwater. Like the whole thing. Like just dump it all out, the garbage, everything. But in the end, still you'll have a healthy mom and healthy baby. So maybe it wasn't the experience that you really were thinking of, but you can still go in with, these are the things that I'm planning for. But keep an open mind and look for that connection with your providers,
Right.
and look for even a connection with the office staff. Now, we struggle a little bit with, with the amount of staff we've had for a little while, or I had a few people who I was like, why are we keeping them around? Like desperation. I'm sure everybody's done that,
Oh, I've seen that through all the offices. Yeah.
But in the end, most of the people that you will connect with will be people that you can tell really care about you.
Right.
That's like super important, even from maybe somebody who's at billing to the person who's making your appointment to the MA who rooms you, as well as the practitioners who are going to follow you through your pregnancy, delivery and birth, and postpartum. Do you feel like you can work with them? Do you feel like you're a part of their like family? Do you feel like you're welcome? Do you feel like you belong? Do you feel like they are receptive? I think that's most important.
Interesting your response, because that's why a lot of my patients, or not my patients, clients of mine will leave other care providers' offices because they don't feel that connection.
Right.
But they have it over at your place. That's definitely, I think maybe everybody there at your center is just more personable,
Maybe.
or maybe because that's important to you.
That's probably more important, is that it's important for me to have people who care about the people who are walking through the door.
Mm-hmm. Well, you definitely feel it when you go there. And so excellent place center for True Harmony and Wellness for OB care. Gynecology, though, you brought that up. So you guys,
we do a lot of gynecology. Dr. Groby is our naturopathic physician, but she does a lot of regular gynecology, and yet she has, well, I don't want to use this for cramps, so try this, or I'm having trouble with my thyroid, or whatever it is. So she also does like IUDs and colposcopy, and she's been with our center for 15 years now, I think.
Yeah, she's excellent.
15 years. So
and she does acupuncture.
Yeah, and she does acupuncture. She does acupuncture for wellness. She's done acupuncture to try to turn a baby before, like a breech baby. She does labor induction acupuncture. And, she doesn't necessarily see OB patients except for that kind of stuff.
Right.
But you can see her afterwards. You know what I mean?
Can someone that's just listening to this, even if they're not a patient, come in and see, let's say Dr. Groby for acupuncture, or Mary come in and have massage?
Yeah. They would just establish. Yeah, absolutely.
That's
absolutely.
great.
Yeah, Mary does massage.
She's so good.
I know. And we're trying to get one more massage therapist because Mary doesn't work the weekends, but that's a really popular time to do massage, to get massage. So
you really offer it all. You offer it all. You've even, we've done Reiki there. I used to do Reiki there with you. That was good. So you're just very open-minded to the whole, I feel like, to the whole part of the patient, right? Healing the whole. And that's what sets you aside. Well, I can't thank you enough for coming on, and
finally, we were
know.
experiencing some technical difficulties earlier.
Yes, we were, but this was great. You sound great. You look great.
Thanks. So do you.
Well, thank you. Well, I'm sure I will see you soon, my dear, and I can't thank you enough. And this was fun. So good to see you. And I hope everyone listening checks out your center and comes and visits you, and really
just Google True Harmony Wellness and it pops right up.
Perfect. I'm sure they will. All right. Have a great night.
Great day.
You too. Bye-bye. This segment brought to you by Cave Creek Beer Borough. Add a little personality to your next party, wedding, or corporate event. Invite Cave Creek Beer Bros to entertain your guests, arriving in style and serving your beer, wine, or beverage of choice. We guarantee they will be the talk of your party. Check them out at cavecreekbeerborough.com or call 602-505-8559. You'll be glad you did.